Hi, everyone, and thank you for joining us for a walkthrough of the 2022 ATLAS Survey. My name is Shannon Biello. I am Vice President of Treatment Quality and Strategy on the ATLAS team, which means I oversee all of our data-related efforts. And I'm really happy that you're joining today so that I can give you an overview of the survey and walk through each of the sections. So just to start, I'll note that on September 7th, everyone will be receiving, every substance use disorder treatment provider in your state will be receiving an email with information on our open enrollment period, which is when we request that substance use disorder treatment providers submit the ATLAS survey. And that email will include your site of care specific link. Now, if you oversee multiple sites of care, you'll have links for each of those sites of care included within the email. I want to note too that we might have multiple contacts in our database for your facility. So multiple people at your facility might be receiving the survey links. And if you want to know who is listed as contacts for your site, please just reach out to us at atlas@shatterproof.org. So once you click that survey link, you'll be taken to this opening screen. You'll notice that it starts with just some basic information about the survey, who we recommend completing the survey, and the materials that we have for providers to assist in completion of the survey. All those are linked here at the bottom. If you go to the next page, you'll just have some additional, more detailed survey information to help with your process. What I'll note is that for questions that are required, you'll see a red asterisk. You won't be able to submit the survey unless all those required questions are completed. So just a brief mention and note. Again, the resources are linked here. We have a PDF copy of the survey if that's useful for you in your process. And we acknowledge that multiple staff might be needed to complete the survey. So the link can be shared amongst staff at your facility. You'll want to use your facility specific link. And also the link saves your progress as you go through. So if you stop at a certain section and you close the survey, you'll be able to return, when you return back to your facility specific link and open it, it will still be on that page. And just to note that if you want to leave the survey and you have data in the survey on that page in front of you, hit the next button. That ensures that the information you entered is saved. Want to make sure you have that saved information. I want to also quickly note that we have a streamlined submission process for our providers that oversee multiple sites of care. So what we do is we have those providers complete a source survey, and then that source survey functions as the source for all other sites of care. So once a provider completes their source survey, we take the responses that they submitted in that and transfer it down to all of their sites of care. From there, all you need to do is answer some site-specific questions, just a couple, including things like staffing, attest the survey, and then complete much in the way that you'll see as we walk through this. So if you're a multi-site provider, please reach out to us because we're more than happy to talk through that process with you. Once we get out of this instructional section, and you'll see again, the deadline for submission, I just want to call that out at the top, is December 30th at 11:59 p.m. Central Time. And then as you go through next, you'll start to see the actual parts of the survey where you'll be entering responses. And they can range anywhere from selects to text fields, etc. And there's instructions about how to enter information on each. You'll start the survey with your facility name and address. If any of this information is incorrect, feel free to update it, but it will be pre-populated with the facility name and address that we have on file. Any updates here are totally fine. We actually request that if something's changed that you update it so we can make sure that that information is updated on our site. What you'll also see at the top is there's some useful links as you go through. You'll always have access to Shatterproof if you're interested in our work. The 2022 reference copy, if helpful for you, linked at the top. Our FAQ page to see some frequently asked questions, and also the help desk if you need to submit a ticket. But again, you can always email us at atlas@shatterproof.org, or you can call us on our helpline. all of that information is listed on the first page of the survey. And it will be included in the emails that you receive about the open enrollment period. The first page of the survey is very basic information. You just go through and add it. You'll see the red asterisks next to things that are required. As you go through, some might be these single selects. The information on this first page is just to ensure that the site of care that you're completing the survey for meets our requirements to be included on ATLAS. So it asks very basic questions like, does this facility offer substance use disorder treatment? Is it open? Does this facility offer in-person treatment at this physical location? And just confirming that this facility does not offer care to specific populations, like incarcerated individuals. The next question asks, what's the best method to contact your facility? The options here are multi-select, so you can pick as many as makes sense. You can do some selections. Here you'll see as you make selections about what contact information is most relevant for your facility. Options appear below. This is called survey logic. So as you're going through, you might see that some questions appear, other questions don't. You really only answer questions that apply to your facility. This is to make this as streamlined as possible for you. So you can add in your phone number, email address, and your fax. I selected fax, so it's there. But really, we're focusing on making sure that we have the most appropriate way that patients are asked to contact this facility, and it can be multiple channels. We end with a question about the facility's website. Note that if a question needs to be in a specific format, that format is provided here. If it needs to include the certain things, like for URL, we ask that you include the HTTPS. And then we finally end with, is this facility owned by a parent organization? A parent organization would be if your facility, and we'll say no, if your facility is overseen by a larger organization, so say it's Treatment Options, and Treatment Options has several sites across your state, Treatment Options would be your parent organization. We get into some site-specific details after this. The first question is a general overview. We have this information to display within your facility profiles that will appear on the ATLAS website. So this is where you can relay some information about your treatment services. You'll note that there's an example text here to give you a sense of what a facility description might look like, and there's a 1,000 character limit. And so you'll know anytime there's these little lines underneath a word, that means we're giving you some definition and example to help you in the submission process. Those are called tooltips. Feel free to scroll over them. I'm literally just moving the cursor over them and the language will appear. These things are also defined on the FAQ page in our glossary, so you can go to either place to get that information. We then get into some information about payment. Once you make multiple selections here, you can click the next button. You'll see that we have information anywhere from cash self-payment, Medicaid, Medicare, private insurance, even some grant options that might be available at this facility. And those are all to cover the different ways in which this facility might offer different payment sources to patients. So you can answer in whatever way makes the most sense for your facility. We then ask for an approximate percentage of patients covered by the payment sources. So you can go through and add these as numbers. Please note that this will need to sum to 100, but we do the math for you at the bottom so that you can use that to help with your submission. So once we have all of that answered, and this will only include the payment sources that you selected on the previous page, again, so you're not entering information that doesn't really make sense for your facility. We ask about other payment options like a sliding fee scale. We ask about if there's free treatment available. And then we have you select which, if you do accept private health insurance, which health insurers your facility is contracted with. These will be state specific. So whichever state you're in, this will be a list generated that makes sense for your state. Same with Medicaid. We have a list of the managed care organizations if that's applicable in your state. And it gives you the option to go through and make selections. And you can select as much as you want based upon which health insurers your facility is contracted with. This is a Pennsylvania specific question, so we're going to skip, but great example of questions that you may or may not see based upon the state that you're in. We round out the payment section with asking about how the facility provides patients or clients with estimated out-of-pocket costs for treatment. What I want to point out too is as you're answering the questions and saying like, yeah, you know, this option applies, you can always select this other option and put in any kind of response that you felt wasn't covered in the options to select for this question. And we'll just put other response there. You'll note too that if you don't answer something correctly, or if you missed a question that's required, you'll get this error message. There's a super helpful link at the top of the page that allows you to go to the first error. I didn't make a selection for the state specific question. So all I have to do is select some options because this is a required question. And then I should be able to proceed on through the survey. This section gets at information on what type of setting it is and what patient populations are served and which substances this facility offers treatment for. Will indicate that this facility is a substance use disorder treatment facility, but you can select any of the other options listed here. We also request that you provide the an MPI for this facility. And then we have you select the levels of care. So I will act as this is an outpatient facility, but you can select whichever one makes the most sense for your program. And then substances. So getting out which specific substances this facility serves from the list here. We'll make all of the selections part of a comprehensive program and also in other fields if needed. And then you'll notice here, because we made selections for outpatient and intensive outpatient levels of care, we're asked to clarify which populations this facility serves. So we can make some selections here. Will be an adult serving facility. Serving all patient populations. We then have a section about treatment access. So it has several questions related to how patients are able to access care at this facility. The first is related to how quickly patients can make appointments. This is an outpatient facility, so it's asking about same-day or walk-in appointments. So you can answer based upon that. We also have questions. If this facility does not offer withdrawal management services, what options might be available to patients in need of withdrawal management services? So you can make some selections there. Again, with these multi-select, please check all that apply. You can select as many as make sense for your facility. And then we end this section asking about telehealth. And what you'll notice is similar to other questions, there might be related questions attached. So if you make certain selections for one question, you might have some questions appear below that are related. So just as you go through and answer, and this is getting more detail about how telehealth services are delivered at this facility. You could also indicate that this facility doesn't offer telehealth services. And then because we select that we have messaging services, it asks us to clarify which messaging services are available. Section D is about personalized evaluation and treatment plan. It begins with asking about which type of assessment is used for intake evaluation. There are some other options available towards the bottom of this question that you can answer if you have an assessment tool that is required by the state, not required by the state, has been developed by this facility, etc. And then we ask about specific time points when this facility collects patient or client data. On the health dimensions listed here, you'll see there are several time points listed across the top. So it's important to make selections based upon what makes the most sense for your facility. You'll see in this table, you can select multiple things. Should you collect, we do not assess. You'll notice that the survey prevents you from making any other selections. So just be aware of that. To get rid of this limitation, all you need to do is uncheck it. And then you should be able to make more selections in the table. We then ask about what instruments are used to collect data over time. So you can make some selections here. And then we ask specifically what instruments are used to collect information on patient or client social determinants of health. There's several options, but you can add another field if you're using another instrument. And then this page rounds out with how often do staff revisit a treatment plan with the patient or client, where you can add a specific period of time as it makes sense for your facility. This section ends with asking about patient data collected through an electronic health record. If you answer yes, we'll ask what specific health information is collected through the EHR. We'll also ask about which EHR the facility uses. There are always options for all of these questions. If the facility is stratifying patient data, by which patient groups? Is this data being used to inform treatment? And then whether client surveys are collected and if they're collected in multiple languages. I'll say no. This section ends with a question about processes used for discharge planning, where you can make multiple selections. And then you'll note here, there's a question at the bottom to provide a screenshot or copy of the template discharge plan. This is one of the questions, and you'll see through the little pop-up here, that's used for data validation. We intend to make these questions as easy to answer as possible. Simply an upload of a template form that you have, and this allows us to check and look at the responses that are submitted throughout the survey. There are several questions that are used for validation. They're all highlighted with that little question mark tooltip to indicate them. And these are not data that are, or materials that are shared publicly. They're simply used for our validation process, which we clarify in the tooltip. The next section is about medications. If your facility offers medications on site, what you'll see is we ask for clarification about which formulations are available and to what extent they're available. You can indicate neither. You can indicate off-site. There's several mechanisms on-site. We will go through and answer for each of these rows. Same for medications for alcohol use disorder. Simply go through and indicate the extent to which these medications are available. Maybe 3 are on-site. If you select this neither option again, you won't be able to make any other options. It's an exclusive select. And then we have the facility indicate how this facility uses either methadone or buprenorphine, if that's indicated in the above table. So it's a question that appears based upon your other responses. This section ends with asking about how this facility administers naloxone. And so you can make some selections here. Section F is behavioral therapies. There are several listed here. You're welcome to make selections that make the most sense for your facility. And you can also, if you feel like some are not captured, you can use the other option, other behavioral. We also have a question about whether one-on-one counseling is available at this site. The next section G is about lab tests. So that will answer questions about lab tests. If you answered no, you'll be able to move on rapidly. But if you answer yes, you'll see there's some logic related to this. We clarify at the top that lab tests can take place on-site or it can take place through an offsite through a third-party organization. So if you're doing or have used a vendor for lab tests, you can still answer that this is a service that's available through your facility. We acknowledge that a number of facilities use offsite vendors for lab testing. There's several questions that appear related to lab testing. Are they required? When are lab tests conducted? And across these different types of lab tests, which is your site using? Maybe we don't use that one. Maybe we only use blood tests, and for what purposes. So you can select several purposes throughout this table. And if there's a lab test that isn't listed here, you can always use this other option, and that will allow you to populate what other lab tests your facility is using. We have a validation question in the lab test section asking about the facility's internal protocols for conducting lab tests. You can either briefly summarize in this text field here, or you can upload an internal protocol. And again, this is for Shatterproof internal use only, not shared publicly. Section H looks at coordinated care for mental health and physical health. We asked to what extent primary healthcare services and mental health care services are available on site. You can make your selections up here in this table. We also ask about what types of screening services are available at this facility. You'll see that we've added COVID-19 testing, sign of the times. We ask, does this facility prescribe medications to treat co-occurring mental health conditions? And then again, we ask you to indicate the highest level of integration, whether it's on-site or through an off-site referral. We have questions related to tobacco cessation interventions. You can select whichever ones make the most sense. And then we have a question about how this facility uses a trauma-informed approach for patients or clients. We have several options listed here. You can make some selections. There's also another field. Or if you do this exclusive select, which I've talked about, you'll see that all the options gray out. That's to make sure that if you're selecting the option, it means that none of those things apply. We end coordinated care with questions about staffing. You'll see we have several staffing positions listed here. What we ask you to do is go through and make some selections based on what types of staff are available on site. This will ensure that you only see questions about those staffing for the remainder of the section. If you don't have a physician on site, whether a psychiatrist or another MD or DO, it will ask if a physician is available for consultation. It will also ask you to clarify for which primary treatment areas these staff are available. So you can make some selections here based upon the staff type. And then it asks you to indicate how many staff are in each position. You can indicate both full-time and part-time. And then it asks about, if relevant, based upon your staff selections, if the staff have any certifications or specific training for substance use disorder. And again, these are very specific to whatever staff type you select. Otherwise, they won't appear in that section. This section deals with recovery support services. It lists several here, and then you're able to indicate whether recovery support services offered on site, whether through a referral or not offered. This is a single select, so you're able to select one option in each of the rows. You'll see if I make another selection, it will switch to that one. And then we ask if you are making these referrals, are you tracking them? The next question is about license. Section J, next section is about licensure. So this is where you can indicate the licensure that your facility holds. We ask that you provide a screenshot or scanned copy. That's for validation purposes too. And then we give you a chance to report on any types of accreditations. And then this section ends with asking if licensure, certification, or accreditation has ever been revoked. Section K is the final section, so we're nearing the end of our time together. It asks additional information about this facility. We have a question that asks about what types of organizational practices for patient-centered care are available on site. So it asks this question across several domains, including staffing, site policies, monitoring. We then have some site-specific questions related to use of tobacco. Is this facility wheelchair accessible? Does this facility provide adaptive technology services? Does this facility provide services for individuals who are deaf or hard of hearing? And then if this facility has any formalized treatment programs tailored to any of the following groups. So that would be a treatment program that is made specifically for a group like adolescents beyond the general standard of care available at this facility. And you'll see this has several domains listed as well. You can indicate for patients with co-occurring conditions. You can indicate for military groups, people with specialized needs, and select whichever ones make the most sense for your facility based upon, again, whether there's a specialized treatment program outside of the general standard of care. We also ask about whether this facility offers any of the following services for patients or clients who identify as LGBTQIA+. So you'll be able to go through and make selections here that make sense. We'll go through and make a couple examples, but you can select as many as make sense for you. If you select none of the above, all of those options above gray out. And then we end with questions about languages. So you'll be able to select whether you offer certain languages at this facility. You'll notice there's an option to indicate interpreting services are offered in every language. That is a requirement for some facilities, so the option's there. Or you can indicate none of these. Should you select a language, what you'll be able to do is indicate whether the service is available with clinical staff fluency, interpreting services, or translated educational material. You can select one or several. We'll say clinical staff fluency and translated educational materials. But that would appear for any language that you make a selection for in that section. And the final round of questions are getting very, very specific to your facility and the information that we relay in the profile. One is giving an option to upload images of your site. That will allow us to display images in your facility profiles. And then we ask about hours. You'll notice that if I indicate that we're open for a set period of time, and then close, we'll say we're closed Friday through Saturday. You make selections based upon the day. So if you're open for a set period of time, you select within here. If you're closed, you select here. Or if you're open 24 hours, you just select down this column. And once that's in place, it will just have you indicate the open hours and closed hours for each day that the facility is open a set period of time. What I'll say is be careful with the formatting here. We give instructions on how to format. It needs to be in hours, minutes, and within AM, PM, just so we can make sure we're reporting the correct hours for your facility. And then the section L is research questions. So it's just answering a couple of research questions that are not displayed publicly, but look at utilization. There's an option in section M to download a PDF version of your survey. This will have all of your response options captured in here. This is a really nice mechanism. If your facility wants to share a PDF with, you'll see there's a little download feature at the bottom and it's a PDF. If the facility wants to archive it, share it with staff, etc. It's especially useful for the final section of the survey, which is attestation. This is where we ask that a senior leader at your facility attest to the accuracy of your responses. All you need to do is select this. I've read this information and attest. But if you need to help them through this process, you could always send that PDF rather than having them go through the survey again to really facilitate that process. It's a nice addition. I'm just sending an email so that they can attest. Use my name. CEO, treatment provider. And we just have this information included here so that we know who attested the survey. We won't use this information. We don't use this information for any other purpose, just If we need to contact the person you attested, it's just in our records for us. And then once you hit next, you're done. Oh, unless you get an error message. And again, we can go to the first error. I didn't select the honorific. Great. So I will select the honorific. And then once I do that, and always just wait a second. If it looks like it's scrolling, it might take a second to submit, so it captures all of your information. But once it's submitted, you will be taken to this thank you screen. And so this thank you screen will indicate that your survey is submitted. Everything's in place. If you have any questions about whether your survey is submitted, you can always contact us. We're always happy to clarify that for you. If you have any questions about completing the survey, again, all of our contact information is on the first page once you open your facility specific link, but feel free to use any of those mechanisms. We're here, we're real people. We want to help you complete the survey. We appreciate your time, and we're so grateful that you're partnering with us on this effort. So hopefully this walkthrough was helpful for you. If you have any more questions in detail about how these questions apply to your facility, having trouble answering, please reach out to us. And thank you for your time. Really appreciate it.